Hello, nursing students. Welcome to Nursing Exam Preparation, your trusted resource for excelling in nursing exams with confidence. In today's video, we'll guide you through 150 multiple-choice questions, MCQs, on hepatitis B, each carefully crafted to challenge your knowledge and deepen your understanding of this important topic. Each question is followed by a detailed explanation to help you not only select the correct answer, but also understand the rationale behind it. Whether you're just starting your studies or reviewing for an upcoming exam, this video will test your skills, enhance your critical thinking, and reinforce key concepts related to hepatitis B. Don't forget to like this video, share it with your fellow students, and subscribe to Nursing Exam Preparation for more valuable resources. Be sure to hit the bell icon to stay updated on our latest videos, all designed to help you succeed. Once you've finished the video, let us know your score in the comments below. We'd love to hear how you did. Let's dive in and work toward mastering hepatitis B and achieving exam success. 1. Which of the following is the primary mode of transmission for hepatitis B virus, HBV? A. Airborne transmission. B. Fecal-oral transmission. C. Bloodborne transmission. D. Sexual transmission. Answer: C. Bloodborne transmission. Rationale: hepatitis B is primarily transmitted through blood and body fluids, including sexual contact, sharing of needles, or from mother to child during birth. Options A and B are incorrect, as hepatitis B is not transmitted via air or fecal-oral routes. Although sexual transmission is common, bloodborne transmission remains the most prominent mode. 2. A patient with acute hepatitis B presents with jaundice, fatigue, and abdominal discomfort. What is the most likely cause of these symptoms? A. Increased bilirubin due to liver inflammation. B. Decreased iron absorption due to liver dysfunction. C. Blood clots in the portal vein. D. Increased ammonia levels from kidney failure. Answer: A. Increased bilirubin due to liver inflammation. Rationale: hepatitis B causes inflammation of the liver, leading to impaired bilirubin metabolism. The resulting accumulation of bilirubin in the bloodstream leads to jaundice. Options B, C, and D are less directly associated with the symptoms described in the context of hepatitis B. 3. Which of the following is a key diagnostic marker for identifying an acute hepatitis B infection? A. HBsAg, hepatitis B surface antigen. B. Anti-HCV antibodies. C. HBV DNA. D. Anti-HBs antibodies. Answer: A. HBsAg, hepatitis B surface antigen. Rationale: HBsAg is the primary marker for acute hepatitis B infection. It indicates that the virus is actively replicating in the body. Anti-HCV antibodies are associated with hepatitis C. HBV DNA levels can be used to monitor chronic infection, and anti-HBs antibodies suggest immunity or prior infection. 4. In the treatment of chronic hepatitis B, which of the following medications is commonly used as a first-line therapy? A. Acetaminophen. B. Adafovir dipivoxal. C. Tenofovir disoproxil fumarate. D. Interferon alpha. Answer: C. Tenofovir disoproxil fumarate. Rationale: tenofovir disoproxil fumarate is a first-line antiviral medication used to manage chronic hepatitis B infection. It suppresses viral replication. Acetaminophen is contraindicated in liver disease, and although interferon alpha and adafovir may be used in some cases, tenofovir is preferred due to its efficacy and safety profile. 5. Which of the following is a complication of chronic hepatitis B infection? A. Asthma. B. Cirrhosis. C. Type 1 diabetes. D. Hypothyroidism. Answer: B. Cirrhosis. Rationale: chronic hepatitis B infection can lead to liver cirrhosis due to long-term liver inflammation. This can result in scarring and impaired liver function. Asthma, type 1 diabetes, and hypothyroidism are not directly associated with hepatitis B infection. 6. A patient is at risk of developing hepatitis B if they are exposed to which of the following? A. Drinking water contaminated with bacteria. B. Sharing needles for intravenous drug use. C. Sharing food with someone who has hepatitis B. D. Coming into contact with saliva. Answer: B. Sharing needles for intravenous drug use. Rationale: sharing needles for intravenous drug use is a well-established route of transmission for hepatitis B. While food and water contamination can lead to other infections, hepatitis B is not transmitted this way. Hepatitis B is also not transmitted through casual contact, such as sharing food or saliva. 7. What is the primary goal of the hepatitis B vaccination? A. To eliminate the virus from the body. B. To prevent liver cancer in infected individuals. C. To boost the immune response against the hepatitis B virus. D. To eradicate chronic infection. Answer: C. To boost the immune response against the hepatitis B virus. Rationale: the primary goal of the hepatitis B vaccine is to stimulate the immune system to produce antibodies that protect against the virus, thereby preventing infection. It does not cure existing infections or eradicate chronic disease, but serves as a preventative measure. 8. A patient who has been diagnosed with hepatitis B is undergoing liver function testing. Which of the following lab values is most likely elevated in this patient? A. Albumin. B. ALT, alanine aminotransferase. C. Hemoglobin. D. Prothrombin time. Answer: B. ALT, alanine aminotransferase. Rationale: ALT is an enzyme released when liver cells are damaged. In hepatitis B, liver inflammation and damage often cause ALT levels to rise significantly. Albumin levels may decrease due to impaired liver function, but ALT is a more direct indicator of liver injury. Hemoglobin and prothrombin time may be altered, but are not as specific to hepatitis B. 9. What is the role of the E antigen, HBAG, in hepatitis B? A. It indicates an acute infection. B. It is a marker for chronic infection with high viral replication. C. It indicates the presence of immunity. D. It is a marker of liver cirrhosis. Answer: B. It is a marker for chronic infection with high viral replication. Rationale: HBAG is a marker for high viral replication in chronic hepatitis B. It indicates active viral replication and higher infectivity. The presence of HBAG suggests a more severe form of the disease. It is not a marker of immunity or cirrhosis. 10. Which of the following is the most effective method of preventing the transmission of hepatitis B? A. Use of condoms during sexual activity. B. Use of antiviral medications. C. Hepatitis B vaccination. D. Avoidance of alcohol consumption. Answer: C. Hepatitis B vaccination. Rationale: hepatitis B vaccination is the most effective method of prevention, as it provides immunity to individuals and helps reduce transmission. While antiviral medications may be used to treat or reduce viral load in infected individuals, vaccination is a proactive strategy for prevention. Condoms and avoiding alcohol are important health practices, but do not provide complete prevention of hepatitis B. 11. What is the first-line intervention for a newborn born to a hepatitis B positive mother? A. Hepatitis B vaccination. B. Antiviral therapy. C. Intravenous immunoglobulin (HVIG). D. Liver transplant. Answer: A. Hepatitis B vaccination. Rationale: the first-line intervention for newborns born to hepatitis B positive mothers is the hepatitis B vaccination, which should be administered within 12 hours of birth, along with HBIG, hepatitis B immunoglobulin. This combination provides protection from the virus. Antiviral therapy and liver transplant are not primary interventions at birth. 12. Which of the following is the most significant risk factor for developing chronic hepatitis B infection? A. Acute infection in children. B. Age at the time of infection. C. Co-infection with hepatitis C. D. Alcohol consumption. Answer: B. Age at the time of infection. Rationale: the younger the age at the time of infection, the higher the risk of developing chronic hepatitis B. Infants and young children are more likely to develop chronic infection than adults. Alcohol consumption and co-infection with hepatitis C may exacerbate liver damage, but are not the most significant risk factors for chronicity. 13. Which laboratory test is used to determine the phase of hepatitis B infection? A. HBsAg, hepatitis B surface antigen. B. HBV DNA levels. C. Anti-HBs, hepatitis B surface antibody. D. HBAg, hepatitis B e antigen. Answer: B. HBV DNA levels. Rationale: HBV DNA levels are used to assess the viral replication phase of hepatitis B infection, which helps determine whether the infection is acute, chronic, or in a phase requiring antiviral treatment. HBsAg and HBAg are markers of infection, but do not assess the replication phase directly. Anti-HBs indicates immunity, not infection. 14. A patient is diagnosed with chronic hepatitis B and is prescribed tenofovir. What is the primary goal of this treatment? A. To cure the infection. B. To suppress viral replication. C. To prevent liver cancer. D. To increase immune function. Answer: B. To suppress viral replication. Rationale: tenofovir is used to suppress viral replication in chronic hepatitis B. It does not cure the infection but helps to reduce viral load and prevent progression of liver damage. While preventing liver cancer and improving immune function are important, the main goal of tenofovir therapy is suppression of the virus. 15. Which of the following is the most likely complication of acute hepatitis B? A. Hepatocellular carcinoma. B. Cirrhosis. C. Fulminant liver failure. D. Portal hypertension. Answer: C. Fulminant liver failure. Rationale: fulminant liver failure is the most severe complication of acute hepatitis B, characterized by rapid liver failure and potential encephalopathy. Hepatocellular carcinoma and cirrhosis are complications of chronic hepatitis B, while portal hypertension is a consequence of cirrhosis. 16. A pregnant woman tests positive for hepatitis B surface antigen, HBsAg. What is the next step in management? A. Initiate antiviral therapy immediately. B. Perform a liver biopsy. C. Screen the infant for hepatitis B at birth. D. Vaccinate the woman. Answer: A. Initiate antiviral therapy immediately. Rationale: pregnant women who test positive for HBsAg should receive antiviral therapy to reduce the risk of transmitting the virus to the infant. Screening the infant and vaccination are important steps after delivery, but antiviral therapy during pregnancy reduces vertical transmission. Liver biopsy is not indicated unless there is evidence of significant liver disease. 17. What is the primary action of the hepatitis B vaccine? A. It inhibits viral replication. B. It triggers the production of antibodies. C. It clears the virus from the liver. D. It directly targets infected liver cells. Answer: B. It triggers the production of antibodies. Rationale: the primary action of the hepatitis B vaccine is to stimulate the immune system to produce antibodies against the virus, providing immunity. It does not directly inhibit viral replication or clear the virus from the liver. The vaccine works by preparing the immune system to fight off future exposures to hepatitis B. 18. Which of the following is most indicative of the resolution of acute hepatitis B infection? A. Presence of HBsAg for more than 6 months. B. Development of anti-HBs antibodies. C. Increased HBV DNA levels. D. Persistent jaundice. Answer: B. Development of anti-HBs antibodies. Rationale: the development of anti-HBs antibodies indicates immunity and resolution of the infection. The presence of HBsAg for more than 6 months suggests chronic infection. Increased HBV DNA levels indicate active viral replication, not resolution, and persistent jaundice suggests ongoing liver dysfunction. 19. What does a positive HBAg indicate in a patient with chronic hepatitis B? A. The patient is highly infectious. B. The patient is immune to the virus. C. The infection is resolved. D. The patient is in the chronic phase with low viral replication. Answer: A. The patient is highly infectious. Rationale: a positive HBAg indicates active viral replication and that the patient is highly infectious. It does not indicate immunity or resolution of the infection. It suggests the patient is in the chronic phase with a high viral load. 20. What is the main route of transmission of hepatitis B in adults? A. Inhalation of respiratory droplets. B. Contact with contaminated water. C. Blood and sexual contact. D. Fecal-oral transmission. Answer: C. Blood and sexual contact. Rationale: hepatitis B is most commonly transmitted through blood and sexual contact in adults. It is not transmitted via respiratory droplets, contaminated water, or fecal-oral routes. 21. A 30-year-old male with chronic hepatitis B presents with fatigue, jaundice, and elevated liver enzymes. What is the next best step? A. Start antiviral therapy. B. Perform a liver biopsy. C. Order HBV DNA levels. D. Begin symptomatic treatment. Answer: C. Order HBV DNA levels. Rationale: in patients with chronic hepatitis B, determining HBV DNA levels helps assess the viral load and guides decisions about antiviral treatment. While antiviral therapy may be necessary, assessing the viral load first is crucial. A liver biopsy is considered for patients with advanced liver disease or unclear prognosis. Symptomatic treatment alone is insufficient. 22. What is the most common complication of untreated chronic hepatitis B infection? A. Hepatocellular carcinoma. B. Diabetes mellitus. C. Renal failure. D. Hypertension. Answer: A. Hepatocellular carcinoma. Rationale: the most common complication of untreated chronic hepatitis B is hepatocellular carcinoma, which is a type of liver cancer. Diabetes, renal failure, and hypertension are not direct complications of untreated hepatitis B. 23. Which of the following groups should receive the hepatitis B vaccine according to current recommendations? A. Only healthcare workers. B. Only individuals with chronic liver disease. C. All infants, children, and adults at risk. D. Only pregnant women. Answer: C. All infants, children, and adults at risk. Rationale: the hepatitis B vaccine is recommended for all infants, children, and adults who are at risk for hepatitis B, including healthcare workers and individuals with chronic liver disease. Pregnant women should be vaccinated if they are at risk, but are not the only group targeted by vaccination. 24. Which of the following is an indication for starting antiviral therapy in a patient with chronic hepatitis B? A. Presence of cirrhosis with elevated liver enzymes. B. Presence of jaundice. C. Positive anti-HBs antibodies. D. Mild fatigue. Answer: A. Presence of cirrhosis with elevated liver enzymes. Rationale: antiviral therapy is indicated in patients with chronic hepatitis B who have evidence of cirrhosis or active viral replication, as indicated by elevated liver enzymes. Jaundice, positive anti-HBs antibodies, and mild fatigue are not sufficient indicators on their own for initiating antiviral therapy. 25. In the context of hepatitis B, what does the term chronic infection refer to? A. Infection lasting more than 6 months. B. Presence of symptoms for more than 1 year. C. The body's inability to clear the virus. D. Development of cirrhosis or liver cancer. Answer: A. Infection lasting more than 6 months. Rationale: chronic hepatitis B infection is defined as an infection lasting more than 6 months. It does not refer to the presence of symptoms, but rather the persistence of the virus in the body. The inability to clear the virus is part of the pathophysiology of chronic infection, but the key criterion is the duration of infection. 26. Which of the following patients should be screened for hepatitis B? A. A 25-year-old male with no history of sexual activity. B. A 45-year-old female with a history of injection drug use. C. A 70-year-old male with a history of hypertension. D. A 30-year-old female with asthma. Answer: B. A 45-year-old female with a history of injection drug use. Rationale: patients with a history of injection drug use are at high risk for hepatitis B and should be screened. Individuals with no history of sexual activity, hypertension, or asthma are generally not at high risk and may not need screening unless there are other risk factors present. 27. A patient with hepatitis B is being considered for liver transplantation. Which of the following is true regarding hepatitis B and liver transplantation? A. Hepatitis B is a contraindication for liver transplant. B. Patients with hepatitis B can receive a liver transplant with antiviral therapy. C. Hepatitis B patients never require antiviral therapy post-transplant. D. Liver transplantation is the primary treatment for chronic hepatitis B. Answer: B. Patients with hepatitis B can receive a liver transplant with antiviral therapy. Rationale: hepatitis B is not an absolute contraindication for liver transplantation. Antiviral therapy is used post-transplant to prevent reinfection of the new liver. It is not the primary treatment for chronic hepatitis B. Antiviral therapy is the primary method to control the infection. 28. Which of the following indicates that a patient with chronic hepatitis B is at high risk for liver cirrhosis? A. Elevated ALT and AST levels with normal bilirubin. B. Positive HbAg with elevated HBV DNA levels. C. Decreased liver function with normal HBV DNA. D. Presence of anti-HBC antibodies. Answer: B. Positive HbAg with elevated HBV DNA levels. Rationale: the presence of HbAg and elevated HBV DNA levels indicates active viral replication and a higher likelihood of progressing to liver cirrhosis. Elevated ALT and AST levels alone do not directly indicate cirrhosis, and the absence of significant viral replication, as shown by normal HBV DNA, suggests a lower risk. Anti-HBC antibodies are markers of past infection, not necessarily an indicator of current risk. 29. What is the primary goal of antiviral therapy in chronic hepatitis B? A. To eliminate the virus from the body. B. To suppress viral replication and reduce liver damage. C. To cure the infection completely. D. To prevent cirrhosis from developing. Answer: B. To suppress viral replication and reduce liver damage. Rationale: the primary goal of antiviral therapy in chronic hepatitis B is to suppress viral replication, thereby reducing liver damage and preventing complications like cirrhosis and liver cancer. The therapy does not eliminate the virus or cure the infection. While preventing cirrhosis is an important outcome, the primary goal is viral suppression. 30. Which of the following is a contraindication to receiving the hepatitis B vaccine? A. Pregnancy. B. History of severe allergic reaction to yeast. C. Immunosuppression. D. Asthma. Answer: B. History of severe allergic reaction to yeast. Rationale: the hepatitis B vaccine contains yeast, and a history of severe allergic reaction to yeast is a contraindication. Pregnant women can safely receive the vaccine, and immunosuppressed individuals are recommended to receive it, although their response may be less robust. Asthma is not a contraindication to vaccination. 31. A patient is diagnosed with hepatitis B and is being treated with pegylated interferon. Which of the following side effects should the nurse monitor for? A. Weight loss. B. Headache and fatigue. C. Increased appetite. D. Hypertension. Answer: B. Headache and fatigue. Rationale: pegylated interferon therapy can cause common side effects such as headache, fatigue, and flu-like symptoms. Weight loss and increased appetite are not typical side effects. Hypertension is not a direct side effect of interferon therapy. 32. What is the purpose of administering hepatitis B immunoglobulin, HBIG, to a newborn of an infected mother? A. To prevent future infections. B. To provide immediate passive immunity. C. To boost the effects of the vaccine. D. To treat acute hepatitis B infection. Answer: B. To provide immediate passive immunity. Rationale: HBIG provides immediate passive immunity to the newborn, preventing infection by neutralizing the virus. It is given along with the hepatitis B vaccine to protect the infant from vertical transmission. It does not treat existing infection but helps prevent infection. 33. In patients with chronic hepatitis B, what factor is most likely to indicate the need for liver transplantation? A. Development of hepatocellular carcinoma. B. Normal liver function tests despite chronic infection. C. Positive HbAg for over 12 months. D. Increased anti-HBs titers. Answer: A. Development of hepatocellular carcinoma. Rationale: the development of hepatocellular carcinoma in a patient with chronic hepatitis B is a key indication for liver transplantation. Hepatitis B-related liver cancer is a common reason for requiring a transplant. Normal liver function tests do not indicate the need for transplant, and positive HbAg or increased anti-HBs titers do not necessitate transplantation in isolation. 34. Which of the following is the most accurate test to monitor the response to antiviral therapy in chronic hepatitis B? A. HBsAg. B. ALT, alanine aminotransferase. C. HBV DNA levels. D. Anti-HBC antibodies. Answer: C. HBV DNA levels. Rationale: monitoring HBV DNA levels is the most accurate way to assess the response to antiviral therapy in chronic hepatitis B. A decrease in viral load indicates the effectiveness of treatment. While HBsAg and ALT levels are also monitored, they do not provide as direct a measure of viral suppression as HBV DNA levels. Anti-HBC antibodies are markers of past infection, not treatment response. 35. Which of the following is considered a risk factor for developing hepatitis B infection? A. Drinking unpasteurized milk. B. Sharing personal hygiene items. C. Working in an office setting. D. Having a high-fiber diet. Answer: B. Sharing personal hygiene items. Rationale: sharing personal hygiene items, such as razors or toothbrushes, can expose individuals to bloodborne pathogens like hepatitis B. Drinking unpasteurized milk, working in an office, and consuming a high-fiber diet are not significant risk factors for hepatitis B. 36. A patient with chronic hepatitis B is being treated with antivirals. Which of the following is most important for the nurse to monitor during treatment? A. Blood pressure. B. Liver function tests. C. Respiratory rate. D. Skin color. Answer: B. Liver function tests. Rationale: monitoring liver function tests is essential during antiviral treatment for chronic hepatitis B to assess for liver damage or complications like cirrhosis or hepatotoxicity. Blood pressure, respiratory rate, and skin color are less directly related to monitoring the effectiveness of antiviral therapy. 37. Which of the following is a characteristic of the immune-tolerant phase of chronic hepatitis B? A. Elevated ALT levels with low HBV DNA. B. Elevated HBV DNA with normal ALT levels. C. Negative HbAg. D. Symptoms of liver failure. Answer: B. Elevated HBV DNA with normal ALT levels. Rationale: the immune-tolerant phase of chronic hepatitis B is characterized by elevated HBV DNA levels with normal ALT levels, indicating active viral replication but minimal liver damage. The other options describe phases of active inflammation or more severe disease. 38. A patient with hepatitis B is diagnosed with cirrhosis. What is the most likely outcome without treatment? A. Full recovery with antiviral therapy. B. Progression to liver failure and death. C. Spontaneous resolution of infection. D. Development of hepatitis A. Answer: B. Progression to liver failure and death. Rationale: without treatment, cirrhosis due to chronic hepatitis B can progress to liver failure, which can be fatal. Antiviral therapy can help manage the infection, but is not a cure for cirrhosis. Hepatitis A is a different virus and would not be a direct consequence of hepatitis B infection. 39. Which of the following tests would indicate that a person has cleared the hepatitis B virus after an acute infection? A. Positive anti-HBs antibodies. B. Positive HbAg. C. High HBV DNA levels. D. Positive HBsAg. Answer: A. Positive anti-HBs antibodies. Rationale: the presence of anti-HBs antibodies indicates that the person has cleared the hepatitis B virus and is immune to future infection. A positive HbAg and high HBV DNA levels suggest ongoing viral replication. HBsAg presence indicates that the virus is still active. 40. A patient has chronic hepatitis B and is found to have a significant viral load. What is the most appropriate management? A. Initiate antiviral therapy. B. Begin chemotherapy. C. Administer steroids. D. Prescribe over-the-counter pain medication. Answer. A. Initiate antiviral therapy. Rationale. A significant viral load in chronic hepatitis B is an indication for initiating antiviral therapy to suppress viral replication and prevent liver damage. Chemotherapy and steroids are not appropriate for hepatitis B, and over-the-counter pain medications will not address the underlying viral infection. 41. In a patient with chronic hepatitis B, what is the role of liver biopsy? A. To monitor the patient's immune system response. B. To assess the extent of liver damage and fibrosis. C. To determine the specific strain of the virus. D. To predict the response to antiviral therapy. Answer. B. The importance of abstaining from alcohol. Rationale. It is important to educate patients with hepatitis B about the need to abstain from alcohol, as it can exacerbate liver damage. Physical activity is not typically restricted unless there is liver failure. Avoiding all contact is unnecessary unless there are specific precautions for viral transmission. Antiviral therapy is generally recommended for long-term use, not just during flare-ups. 42. What is the primary mode of prevention of hepatitis B? A. Antiviral medications. B. Vaccination. C. Antibiotics. D. Antifungal medications. Answer. B. Vaccination. Rationale. The primary mode of prevention for hepatitis B is vaccination. Antiviral medications are used for treatment, not prevention. Antibiotics and antifungal medications do not prevent viral infections like hepatitis B. 43. A patient is diagnosed with hepatitis B. Which of the following is an indication for hospitalization? A. Fatigue and mild jaundice. B. Severe liver dysfunction and bleeding. C. Positive anti-HBs antibodies. D. Chronic low-level HBV DNA. Answer. B. Severe liver dysfunction and bleeding. Rationale. Severe liver dysfunction and bleeding, such as an acute liver failure or decompensated cirrhosis, require hospitalization for intensive management. Fatigue, mild jaundice, and positive anti-HBs antibodies are not reasons for hospitalization unless more severe symptoms are present. Chronic low-level HBV DNA does not typically require hospitalization without evidence of liver decompensation. 44. What should be included in the education for a patient recently diagnosed with hepatitis B? A. Restrict all physical activity immediately. B. The importance of abstaining from alcohol. C. Avoid all contact with others. D. The need for antiviral therapy only during flare-ups. Answer. B. The importance of abstaining from alcohol. Rationale. It is important to educate patients with hepatitis B about the need to abstain from alcohol, as it can exacerbate liver damage. Physical activity is not typically restricted unless there is liver failure. Avoiding all contact is unnecessary unless there are specific precautions for viral transmission. Antiviral therapy is generally recommended for long-term use, not just during flare-ups. 45. What is the primary route of transmission of hepatitis B in infants? A. Breastfeeding. B. Vertical transmission during childbirth. C. Through contaminated food. D. Respiratory droplets. Answer. B. Vertical transmission during childbirth. Rationale. Hepatitis B is most commonly transmitted to infants through vertical transmission during childbirth. Breastfeeding does not transmit the virus if the mother has no active lesions or blood. Contaminated food and respiratory droplets are not routes of transmission for hepatitis B. 46. Which of the following best describes the hepatitis B surface antigen, HBsAg? A. It indicates immunity to hepatitis B. B. It is a marker of active viral replication. C. It is present only in acute hepatitis B. D. It is an antibody produced by the liver. Answer. B. It is a marker of active viral replication. Rationale. HBsAg is a surface protein of the hepatitis B virus, and its presence indicates active viral replication, meaning the person is infected. It is not a marker of immunity. Anti-HBs is the marker for immunity. It is present in both acute and chronic hepatitis B infection, not only in acute cases. 47. What is the significance of a positive anti-HB test in a patient with chronic hepatitis B? A. The patient has cleared the virus. B. The virus is replicating aggressively. C. The patient has low infectivity. D. The patient is in the immune-tolerant phase. Answer. C. The patient has low infectivity. Rationale. A positive anti-HB test indicates that the patient has seroconverted from HBAg to anti-HB, meaning the viral replication is lower and the patient has reduced infectivity. It does not indicate the virus has been cleared, nor does it describe the immune-tolerant phase, which involves high viral replication. 48. Which of the following factors increases the risk of vertical transmission of hepatitis B from mother to infant? A. Presence of anti-HBs antibodies in the mother. B. High viral load in the mother. C. Mild liver disease in the mother. D. Early initiation of antiviral therapy in the mother. Answer. B. High viral load in the mother. Rationale. A high viral load in the mother significantly increases the risk of vertical transmission of hepatitis B to the infant. Anti-HBs antibodies indicate immunity, not a risk for transmission. Mild liver disease does not directly affect the risk of transmission, and antiviral therapy in the mother reduces, rather than increases, the risk. 49. A nurse is educating a patient with hepatitis B about transmission precautions. Which of the following should the nurse emphasize? A. Hepatitis B is only transmitted through sexual contact. B. The virus can be transmitted through sharing needles or razors. C. Hepatitis B cannot be transmitted through blood. D. Only people with acute hepatitis B are contagious. Answer. B. The virus can be transmitted through sharing needles or razors. Rationale. Hepatitis B is a blood-borne virus that can be transmitted through contact with contaminated blood, such as sharing needles, razors, or other personal items. It is not transmitted only through sexual contact, nor can it be transmitted exclusively through acute infections. It can also be transmitted through blood and body fluids. 50. A 28-year-old male with hepatitis B is planning to travel abroad. What advice should the nurse provide regarding vaccination for hepatitis A? A. Hepatitis A vaccination is not necessary. B. Hepatitis A vaccination is recommended due to the risk of co-infection. C. Hepatitis A vaccination will cure hepatitis B. D. Hepatitis A vaccination is contraindicated in hepatitis B patients. Answer. B. Hepatitis A vaccination is recommended due to the risk of co-infection. Rationale. People with chronic hepatitis B are at increased risk of developing more severe liver disease if they also contract hepatitis A. Therefore, the hepatitis A vaccine is recommended for travelers with hepatitis B. It does not cure hepatitis B, and it is not contraindicated in patients with hepatitis B. 51. Which of the following is the most important aspect of post-exposure prophylaxis for a newborn born to a hepatitis B-positive mother? A. Administering hepatitis A vaccine. B. Administering hepatitis B vaccine and HBIG, hepatitis B immunoglobulin. C. Providing antiviral therapy immediately. D. Delaying vaccination until the infant is older than 6 months. Answer. B. Administering hepatitis B vaccine and HBIG, hepatitis B immunoglobulin. Rationale. The most important aspect of post-exposure prophylaxis for a newborn born to a hepatitis B-positive mother is the administration of both the hepatitis B vaccine and HBIG to prevent infection. The vaccine alone is not sufficient, and antiviral therapy is not necessary for the newborn. Delaying vaccination would increase the risk of infection. 52. Which of the following symptoms is most commonly associated with acute hepatitis B infection? A. Jaundice. B. Loss of appetite and diarrhea. C. Severe abdominal pain and distension. D. Sore throat and cough. Answer. A. Jaundice. Rationale: jaundice is a classic symptom of acute hepatitis B infection due to liver inflammation and impaired bilirubin metabolism. Loss of appetite and diarrhea can be present, but jaundice is more directly associated with hepatitis B. Severe abdominal pain and distension are not typical in the acute phase, and sore throat and cough are unrelated to hepatitis B. 53. Which of the following laboratory results would indicate that a patient with hepatitis B is in the inactive carrier phase? A. Negative HBAG, with undetectable HBV DNA and normal ALT. B. Positive HBAG, with high HBV DNA levels. C. Elevated ALT levels with positive anti-HBs antibodies. D. Positive HBsAg, with elevated ALT levels. Answer: A. Negative HBAG, with undetectable HBV DNA and normal ALT. Rationale: the inactive carrier phase of hepatitis B is characterized by negative HBAG, undetectable HBV DNA, and normal ALT levels, indicating low levels of viral replication and minimal liver damage. Elevated ALT levels or positive HBAG with high HBV DNA levels indicate active infection, not the inactive carrier phase. 54. Which of the following is the most effective strategy to prevent hepatitis B in healthcare workers? A. Wearing gloves and masks during patient care. B. Vaccination against hepatitis B. C. Using antiviral medications as prophylaxis. D. Regular blood tests for HBV DNA levels. Answer: B. Vaccination against hepatitis B. Rationale: vaccination is the most effective strategy to prevent hepatitis B in healthcare workers as it provides immunity to the virus. While wearing gloves and masks is essential for infection control, vaccination is the primary prevention strategy. Antiviral medications are not used as prophylaxis for hepatitis B in this context, and regular blood tests are not necessary for prevention. 55. Which of the following is a potential complication of chronic hepatitis B infection? A. Hypertension. B. Cirrhosis and hepatocellular carcinoma. C. Diabetes mellitus. D. Pulmonary embolism. Answer: B. Vaccination against hepatitis B. Rationale: vaccination is the most effective strategy to prevent hepatitis B in healthcare workers as it provides immunity to the virus. While wearing gloves and masks is essential for infection control, vaccination is the primary prevention strategy. Antiviral medications are not used as prophylaxis for hepatitis B in this context, and regular blood tests are not necessary for prevention. 56. A patient with chronic hepatitis B has been prescribed tenofovir. Which of the following side effects should the nurse monitor for? A. Renal toxicity. B. Hyperglycemia. C. Hypothyroidism. D. Hypokalemia. Answer: B. Cirrhosis and hepatocellular carcinoma. Rationale: chronic hepatitis B infection can lead to cirrhosis and hepatocellular carcinoma, liver cancer, which are serious complications of long-term viral infection. Hypertension, diabetes mellitus, and pulmonary embolism are not directly caused by hepatitis B infection. 57. Which of the following is true about the hepatitis B vaccination schedule for infants? A. The first dose should be given at birth, followed by 2 more doses. B. The first dose should be given at 6 months of age. C. The vaccine is given only to high-risk infants. D. The vaccine is given in a one-time dose at birth. Answer: A. The first dose should be given at birth, followed by 2 more doses. Rationale: the recommended hepatitis B vaccination schedule for infants includes the first dose at birth, followed by 2 more doses at 1 to 2 months and 6 to 18 months. The vaccine is recommended for all infants, not just high-risk ones. 58. A patient diagnosed with chronic hepatitis B asks the nurse if they can drink alcohol. What is the nurse's best response? A. Moderate alcohol consumption is safe. B. It is important to avoid alcohol completely. C. You can drink occasionally in moderation. D. Alcohol does not affect your liver function. Answer: B. It is important to avoid alcohol completely. Rationale: alcohol can worsen liver damage in individuals with hepatitis B, potentially leading to cirrhosis or liver failure. It is best to advise patients to avoid alcohol completely to protect their liver. Moderate or occasional drinking is not safe in this context. Alcohol does affect liver function, especially in patients with chronic liver disease. 59. Which of the following tests is most commonly used to assess the severity of liver damage in hepatitis B? A. HBsAg test. B. Liver biopsy. C. Anti-HBC antibodies test. D. HBAG test. Answer: B. Liver biopsy. Rationale: a liver biopsy is the gold standard for assessing the severity of liver damage, including the degree of fibrosis and cirrhosis, in hepatitis B patients. The other tests are important for diagnosing and monitoring the infection but do not directly measure liver damage severity. 60. A patient with hepatitis B reports feeling fatigued and weak. Which of the following is the best action for the nurse to take? A. Tell the patient to rest and drink fluids. B. Recommend the patient start an exercise regimen. C. Monitor the patient's liver function tests. D. Advise the patient to stop taking medications. Answer: C. Monitor the patient's liver function tests. Rationale: fatigue and weakness are common symptoms of hepatitis B, especially if liver function is impaired. Monitoring liver function tests will help assess the extent of liver damage. Rest and fluids are helpful, but not specific to hepatitis B. Exercise may be contraindicated depending on liver function, and stopping medications is not recommended without further assessment. 61. Which of the following is the first step in post-exposure prophylaxis for an individual exposed to hepatitis B? A. Administer antiviral therapy. B. Administer hepatitis B vaccine. C. Administer hepatitis B immunoglobulin, HBIG. D. Test for HBsAg. Answer: B. Administer hepatitis B vaccine. Rationale: the first step in post-exposure prophylaxis for someone exposed to hepatitis B is to administer the hepatitis B vaccine. In some cases, HBIG is also given, but the vaccine is the first intervention. Antiviral therapy is not typically used for post-exposure prophylaxis, and testing for HBsAg may be part of ongoing management, but not the immediate response. 62. A patient with chronic hepatitis B presents with elevated ALT levels. Which of the following is most likely? A. Active viral replication. B. Presence of anti-HBs antibodies. C. Liver cirrhosis. D. Complete recovery from infection. Answer: A. Active viral replication. Rationale: elevated ALT levels indicate liver inflammation, which is often due to active viral replication in hepatitis B. The presence of anti-HBs antibodies indicates immunity and is not associated with elevated ALT. Liver cirrhosis can cause abnormal liver function tests, but elevated ALT specifically suggests active infection. Complete recovery would typically result in normal liver enzymes. 63. Which of the following interventions is recommended for a pregnant woman with chronic hepatitis B to reduce the risk of transmission to the baby? A. Avoid breastfeeding. B. Administer hepatitis B vaccine to the newborn immediately after birth. C. Terminate the pregnancy to prevent transmission. D. Avoid all contact with the newborn. Answer: B. Administer hepatitis B vaccine to the newborn immediately after birth. Rationale: administering the hepatitis B vaccine and hepatitis B immunoglobulin, HBIG, to the newborn immediately after birth significantly reduces the risk of vertical transmission. Breastfeeding is safe as long as the baby receives the vaccine and HBIG. Terminating the pregnancy is not a recommended strategy. Avoiding contact is unnecessary unless there are specific signs of infection. 64. What is the purpose of the hepatitis B e antigen, HBAG, in the diagnosis of hepatitis B infection? A. It indicates the presence of immunity. B. It is a marker of ongoing viral replication. C. It indicates the development of chronic hepatitis B. D. It is an indicator of liver failure. Answer: B. It is a marker of ongoing viral replication. Rationale: HBAG is a marker of active viral replication and indicates higher infectivity in a patient with hepatitis B. It is not a marker of immunity, liver failure, or the development of chronic hepatitis B, though it can be present during the acute phase or in patients with high viral loads. 65. Which of the following is a risk factor for chronic hepatitis B infection? A. Spontaneous clearance of the virus. B. Age over 50 years at the time of infection. C. Co-infection with hepatitis D. Having an elevated anti-HBs antibody level. Answer. C. Co-infection with hepatitis D. Rationale. Co-infection with hepatitis D, a defective virus that requires hepatitis B for replication, is a major risk factor for the progression of chronic hepatitis B and more severe liver disease. Spontaneous clearance of the virus typically occurs in acute infections, not chronic. Age over 50 is a risk factor for complications, but not necessarily for chronic infection. Elevated anti-HBs antibodies indicate immunity, not a risk factor for chronic infection. 66. What is the most common mode of transmission of hepatitis B in adults? A. Sexual contact. B. Airborne transmission. C. Ingestion of contaminated food or water. D. Fecal-oral route. Answer. A. Sexual contact. Rationale. Hepatitis B is most commonly transmitted through sexual contact, as the virus is present in blood and body fluids. It is not transmitted via airborne routes, contaminated food or water, or the fecal-oral route. 67. A patient with chronic hepatitis B is found to have an elevated HBV DNA level and normal ALT levels. What does this indicate? A. The virus is actively replicating but causing minimal liver damage. B. The patient is in the immune-tolerant phase. C. The patient has progressed to cirrhosis. D. The viral infection has cleared. Answer. A. The virus is actively replicating but causing minimal liver damage. Rationale. Elevated HBV DNA with normal ALT levels suggests that the virus is replicating actively, but liver damage is minimal, which is often seen in chronic hepatitis B. The immune-tolerant phase involves high viral replication but typically without significant liver damage. Cirrhosis would typically present with elevated ALT levels, and clearing the virus would lead to negative HBV DNA and normal liver function tests. 68. What is the primary treatment goal in managing chronic hepatitis B? A. Complete eradication of the virus. B. Suppression of viral replication. C. Prevention of hepatitis C co-infection. D. Prevention of acute hepatitis B infection. Answer. B. Suppression of viral replication. Rationale. The primary goal of treatment in chronic hepatitis B is to suppress viral replication and reduce the risk of liver damage. Complete eradication of the virus is not typically achievable with current therapies. Preventing hepatitis C co-infection and acute hepatitis B infection are important, but the focus in chronic hepatitis B is on controlling viral replication. 69. Which of the following is the most important consideration when prescribing antiviral therapy for chronic hepatitis B? A. The patient's level of HBV DNA and ALT levels. B. The patient's history of alcohol use. C. The patient's age. D. The presence of anti-HBc antibodies. Answer. A. The patient's level of HBV DNA and ALT levels. Rationale. The decision to start antiviral therapy in chronic hepatitis B is based on the level of HBV DNA, viral load, and ALT, liver inflammation. Alcohol use, age, and the presence of anti-HBc antibodies are not the primary factors in determining the need for antiviral therapy. 70. Which of the following vaccines is used to prevent hepatitis B infection? A. Hepatitis B vaccine. B. Measles, mumps, rubella, MMR vaccine. C. Hepatitis A vaccine.
D. Pneumococcal vaccine.
Answer. A. Hepatitis B vaccine. Rationale. The hepatitis B vaccine is specifically designed to prevent hepatitis B infection. The MMR vaccine protects against measles, mumps, and rubella, while the hepatitis A vaccine prevents hepatitis A infection, and the pneumococcal vaccine protects against pneumococcal infections. 71. A patient with hepatitis B is prescribed tenofovir for chronic infection. Which of the following side effects should the nurse monitor for? A. Renal toxicity. B. Hyperlipidemia. C. Weight gain. D. increased uric acid levels. Answer: A. Renal toxicity. Rationale: tenofovir is associated with renal toxicity and kidney function should be monitored regularly during treatment. Hyperlipidemia, weight gain, and increased uric acid levels are not common side effects of tenofovir. 72. A patient newly diagnosed with chronic hepatitis B is concerned about the future. What is the nurse's best response regarding long-term prognosis? A. Hepatitis B can be fully cured with treatment. B. Most people with chronic hepatitis B will eventually develop cirrhosis or liver cancer. C. You may live a normal life with proper treatment and monitoring. D. You will need a liver transplant in the near future. Answer: C. You may live a normal life with proper treatment and monitoring. Rationale: with proper antiviral treatment and monitoring, many individuals with chronic hepatitis B can live normal lives without progressing to cirrhosis or liver cancer. Hepatitis B is not typically curable, but it can be managed effectively. Not everyone with chronic hepatitis B develops cirrhosis or liver cancer, and a liver transplant is not always necessary. 73. What is the role of HBV DNA quantification in managing chronic hepatitis B? A. To assess the level of liver fibrosis. B. To measure the degree of immune response. C. To monitor the degree of viral replication. D. To determine the appropriate dose of antiviral therapy. Answer: C. To monitor the degree of viral replication. Rationale: HBV DNA quantification is used to monitor the level of viral replication, which helps in assessing the need for antiviral therapy and tracking treatment effectiveness. It does not directly measure liver fibrosis, immune response, or dictate dosing of antiviral drugs, although it can influence treatment decisions. 74. A 5-year-old child receives the first dose of the hepatitis B vaccine. What is the correct timing for the second dose? A. 1 month after the first dose. B. 2 months after the first dose. C. 6 months after the first dose. D. 1 year after the first dose. Answer: B. 2 months after the first dose. Rationale: the standard hepatitis B vaccine schedule for children includes the first dose at birth, the second dose at 1 to 2 months, and the third dose at 6 to 18 months. The second dose is given 2 months after the first, not 1 month or 1 year later. 75. What is the primary goal in the treatment of acute hepatitis B? A. Eradicate the virus completely. B. Relieve symptoms and monitor for complications. C. Initiate long-term antiviral therapy. D. Prevent transmission to others. Answer: B. Relieve symptoms and monitor for complications. Rationale: in acute hepatitis B, treatment is primarily supportive, focusing on symptom relief and monitoring for complications, such as acute liver failure. Eradication of the virus is not typically achievable, and long-term antiviral therapy is not necessary for acute cases. Preventing transmission is important, but not the primary goal in acute infection. 76. A patient with hepatitis B is planning a pregnancy. What is the nurse's best advice regarding transmission? A. The risk of transmission to the baby can be eliminated with proper antenatal care. B. Pregnancy should be avoided as hepatitis B will always affect the baby. C. The risk of transmission is high only if the mother is symptomatic. D. Antiviral therapy should be started immediately before conception. Answer: A. The risk of transmission to the baby can be eliminated with proper antenatal care. Rationale: with appropriate prenatal care, including vaccination of the newborn and the use of antiviral therapy if necessary, the risk of vertical transmission can be minimized. Pregnancy does not need to be avoided, and the risk is not based on the mother's symptoms, but on viral load. Antiviral therapy may be considered, but it is not always required before conception. 77. A patient diagnosed with chronic hepatitis B is advised to start antiviral therapy. What is the primary goal of this treatment? A. To cure the infection completely. B. To reduce viral replication and prevent liver damage. C. To alleviate symptoms of fatigue and jaundice. D. To prevent transmission to other individuals. Answer: B. To reduce viral replication and prevent liver damage. Rationale. The main goal of antiviral therapy in chronic hepatitis B is to suppress viral replication and prevent liver damage, including progression to cirrhosis or liver cancer. Complete eradication is not always achievable, and treatment is not primarily aimed at alleviating symptoms, though this may occur. Preventing transmission is important but secondary to controlling viral replication in chronic cases. 78. Which of the following is the most common cause of cirrhosis in patients with chronic hepatitis B? A. Alcohol consumption. B. Co-infection with hepatitis C. C. Chronic viral replication. D. Non-alcoholic fatty liver disease, NEFLD. Answer. C. Chronic viral replication. Rationale. Chronic viral replication of hepatitis B can lead to liver inflammation and scarring, fibrosis, which may eventually progress to cirrhosis. Alcohol consumption, co-infection with hepatitis C, and NEFLD may exacerbate liver damage, but are not the most common causes of cirrhosis in patients with chronic hepatitis B. 79. What is the role of the hepatitis B surface antibody, anti-HBs, test in the diagnosis of hepatitis B infection? A. It indicates active viral replication. B. It confirms immunity to hepatitis B. C. It determines the need for antiviral therapy. D. It indicates the presence of the virus in the liver. Answer. B. It confirms immunity to hepatitis B. Rationale. The presence of anti-HBs indicates immunity to hepatitis B, either due to vaccination or previous infection. It does not confirm active viral replication, nor does it indicate the presence of the virus in the liver. It is not used to determine the need for antiviral therapy, which is typically based on HBV DNA levels and ALT. 80. Which of the following is an essential preventive measure for healthcare workers at risk of hepatitis B? A. Frequent testing for HBsAg. B. Routine vaccination with a hepatitis B vaccine. C. Wearing gloves during patient contact only. D. Avoiding any exposure to blood and body fluids. Answer. B. Routine vaccination with a hepatitis B vaccine. Rationale. Routine vaccination with a hepatitis B vaccine is the most effective preventive measure for healthcare workers at risk of exposure to the virus. Frequent testing for HBsAg is not routinely recommended. Wearing gloves and avoiding exposure are part of infection control but not sufficient without vaccination. 81. A patient diagnosed with chronic hepatitis B asks about the risk of developing liver cancer. What is the nurse's best response? A. You will not develop liver cancer unless you also have hepatitis C. B. Chronic hepatitis B can increase your risk of liver cancer, but regular monitoring can help detect it early. C. Liver cancer is rare in people with hepatitis B infection. D. Liver cancer is only a risk in individuals with cirrhosis. Answer. B. Chronic hepatitis B can increase your risk of liver cancer, but regular monitoring can help detect it early. Rationale. Chronic hepatitis B increases the risk of developing hepatocellular carcinoma, liver cancer, even in the absence of cirrhosis. Regular monitoring, including liver function tests and imaging, can help detect early signs of liver cancer. Liver cancer is not rare in individuals with chronic infection, and it can occur regardless of cirrhosis status. 82. Which of the following statements is true regarding the hepatitis B vaccine schedule for adults who are not at high risk? A. It requires only one dose. B. It is given as a series of 3 doses over 6 months. C. The vaccine is not necessary for healthy adults. D. The second dose is given immediately after the first. Answer. B. It is given as a series of 3 doses over 6 months. Rationale. The standard hepatitis B vaccination schedule for adults is a series of 3 doses over 6 months, typically given at 0, 1, and 6 months. The vaccine is recommended for all adults, not just those at high risk. The second dose is not given immediately after the first, but rather at 1 month. 83. A patient with hepatitis B is taking entecavir. What is the most important nursing consideration when administering this medication? A. Monitor for signs of gastrointestinal bleeding. B. Monitor renal function regularly. C. Monitor for signs of depression. D. Monitor blood glucose levels regularly. Answer: B. Monitor renal function regularly. Rationale: entecavir is an antiviral medication used to treat chronic hepatitis B, and it can cause renal toxicity. Kidney function should be monitored regularly during treatment. It does not commonly cause gastrointestinal bleeding, depression, or significant changes in blood glucose levels. 84. Which of the following is a common complication of chronic hepatitis B infection? A. Asthma. B. Renal failure. C. Liver failure and cirrhosis. D. Stroke. Answer: C. Liver failure and cirrhosis. Rationale: chronic hepatitis B infection can lead to complications such as liver failure, cirrhosis, and hepatocellular carcinoma, liver cancer. Asthma, renal failure, and stroke are not typical complications of hepatitis B infection. 85. A nurse is educating a patient with hepatitis B about lifestyle modifications. Which of the following should the nurse emphasize? A. Avoid alcohol completely to prevent further liver damage. B. You should avoid all physical activity. C. You can eat anything you want, but limit salt intake. D. You should increase protein intake to help liver regeneration. Answer: A. Avoid alcohol completely to prevent further liver damage. Rationale: alcohol can worsen liver damage in individuals with hepatitis B and should be avoided completely. Physical activity is generally safe and beneficial unless liver function is severely impaired. Salt intake may need to be restricted if liver disease progresses, but protein intake should be monitored based on liver function. 86. Which of the following laboratory findings is indicative of chronic hepatitis B infection? A. Negative HBsAg, positive anti-HBc. B. Positive HBsAg, positive anti-HBs. C. Positive HBsAg, positive anti-HBc. D. Negative HBsAg, negative anti-HBc. Answer: C. Positive HBsAg, positive anti-HBc. Rationale: chronic hepatitis B infection is confirmed by the presence of HBsAg, hepatitis B surface antigen, and anti-HBc, hepatitis B core antibodies. A negative HBsAg with positive anti-HBc suggests past infection or immunity, while a positive anti-HBs indicates immunity, not active infection. 87. Which of the following interventions is a priority for a newborn born to a mother with chronic hepatitis B? A. Start antiviral therapy immediately. B. Administer hepatitis B vaccine and HBIG, hepatitis B immunoglobulin. C. Monitor the newborn for jaundice. D. Perform a liver biopsy on the newborn. Answer: B. Administer hepatitis B vaccine and HBIG, hepatitis B immunoglobulin. Rationale: the priority intervention for a newborn born to a hepatitis B positive mother is the immediate administration of the hepatitis B vaccine and hepatitis B immunoglobulin, HBIG, to prevent infection. Antiviral therapy is not typically necessary for newborns, and liver biopsies are not performed on newborns unless there is a clinical indication. Which of the following is a risk factor for developing chronic hepatitis B infection? A. Early childhood infection. B. High ALT levels in acute infection. C. Hepatitis B vaccination at birth. D. Infection with a low viral load. Answer: A. Early childhood infection. Rationale: early childhood infection with hepatitis B is a major risk factor for developing chronic hepatitis B infection. High ALT levels during acute infection may indicate liver inflammation but are not a risk for chronicity. Vaccination at birth protects against chronic infection, and a low viral load generally indicates less risk for chronicity. 89. A patient with hepatitis B asks the nurse if they should follow a special diet. What is the best response? A. You should follow a low-fat, high-protein diet to help the liver heal. B. There are no special dietary restrictions, just avoid alcohol. C. You need to follow a strict low-sodium diet. D. You should avoid carbohydrates and eat a high-protein diet. Answer: B. There are no special dietary restrictions, just avoid alcohol. Rationale: there are no specific dietary restrictions for most individuals with hepatitis B, other than avoiding alcohol to prevent further liver damage. A healthy, balanced diet is recommended, but low sodium, low fat, and low carbohydrate diets are not universally necessary unless there is liver cirrhosis or other complications. 90. Which of the following statements about the long-term management of hepatitis B is true? A. Hepatitis B can be completely cured with antiviral therapy. B. The goal of treatment is to suppress viral replication and monitor for complications. C. Antiviral therapy should be discontinued after 1 year. D. Liver transplant is required for all patients with chronic hepatitis B. Answer. B. The goal of treatment is to suppress viral replication and monitor for complications. Rationale. The goal of long-term management of hepatitis B is to suppress viral replication, reduce the risk of liver damage, and monitor for complications such as cirrhosis or liver cancer. Hepatitis B is not typically cured with antiviral therapy, and long-term therapy may be necessary. Liver transplantation is not required for all patients, only those with severe liver disease. 91. A patient with hepatitis B is started on antiviral therapy. What is the most important factor to monitor during treatment? A. Body temperature. B. Liver function tests, ALT, AST. C. Blood glucose levels. D. White blood cell count. Answer. B. Liver function tests, ALT, AST. Rationale. Monitoring liver function tests, including ALT and AST, is essential during antiviral therapy to assess the effectiveness of treatment and monitor for any liver damage or side effects. Body temperature, blood glucose, and white blood cell count are not the primary factors to monitor in hepatitis B treatment. 92. Which of the following is true about the management of acute hepatitis B infection? A. It requires immediate antiviral therapy. B. It is usually self-limiting and does not require specific treatment. C. It often leads to chronic hepatitis B in adults. D. It requires a liver transplant in most cases. Answer. B. It is usually self-limiting and does not require specific treatment. Rationale. Acute hepatitis B is typically self-limiting, and many individuals recover without requiring antiviral treatment. It does not usually require a liver transplant unless there is acute liver failure. While some adults may develop chronic infection, most acute cases resolve without progression. 93. A nurse is educating a patient with hepatitis B about potential complications. Which of the following complications is the nurse most concerned about? A. Hemorrhoids. B. Hepatocellular carcinoma, liver cancer. C. Peptic ulcer disease. D. Osteoporosis. Answer. B. Hepatocellular carcinoma, liver cancer. Rationale. Hepatocellular carcinoma, liver cancer, is a major concern for patients with chronic hepatitis B, especially if they have cirrhosis. Hemorrhoids, peptic ulcer disease, and osteoporosis are not directly related to hepatitis B infection. 94. A 3-year-old child who is born to a hepatitis B-positive mother is being vaccinated. Which of the following is the correct dose of the hepatitis B vaccine for this child? A. 1 dose at 6 months of age. B. 3 doses over a 6-month period. C. 2 doses at 1-month intervals. D. 4 doses at 1-month intervals. Answer. B. 3 doses over a 6-month period. Rationale. The standard hepatitis B vaccination schedule for children includes 3 doses, 1 at birth, 1 at 1 to 2 months, and 1 at 6 months. The child will also receive hepatitis B immunoglobulin, HBIG, at birth to prevent infection. 95. Which of the following is a sign of acute hepatitis B infection? A. Jaundice. B. Hypertension. C. Hematuria. D. Joint pain. Answer. A. Jaundice. Rationale. Jaundice, or yellowing of the skin and eyes, is a common sign of acute hepatitis B infection due to liver dysfunction. Hypertension, hematuria, and joint pain are not typical signs of acute hepatitis B infection. 96. A patient with hepatitis B is receiving antiviral therapy. What is the primary goal of this treatment? A. Cure the infection completely. B. Prevent liver transplant. C. Suppress viral replication and reduce liver damage. D. Treat the symptoms of fatigue and jaundice. Answer. C. Suppress viral replication and reduce liver damage. Rationale: the primary goal of antiviral therapy in hepatitis B is to reduce viral replication, which in turn reduces liver damage and prevents complications like cirrhosis or liver cancer. While the infection may not be cured, viral suppression is key to managing the disease. Liver transplant and symptom treatment are secondary goals. 97. Which of the following diagnostic tests is most commonly used to confirm the presence of active hepatitis B infection? A. Hepatitis B surface antibody, anti-HBs. B. Hepatitis B surface antigen, HBsAg. C. Hepatitis B core antibody, anti-HBc. D. Hepatitis B e antigen, HBAg. Answer: B. Hepatitis B surface antigen, HBsAg. Rationale: HBsAg is the marker used to confirm active hepatitis B infection. If HBsAg is positive, it indicates that the virus is currently present in the body. Anti-HBs indicates immunity, anti-HBc suggests past infection or ongoing infection, and HBAg indicates high viral replication, but HBsAg is the definitive marker for current infection. 98. A nurse is educating a patient about the hepatitis B vaccination schedule. Which of the following is true? A. The first dose is given at birth, the second at 2 months, and the third at 6 months. B. The vaccine series requires only 2 doses. C. The third dose should be given at 1 year of age. D. The first dose is given at 2 months of age. Answer: A. The first dose is given at birth, the second at 2 months, and the third at 6 months. Rationale: the standard hepatitis B vaccination schedule for infants includes 3 doses. The first dose is given at birth, the second at 2 months, and the third at 6 months. This schedule ensures adequate protection. 2 doses or delaying the third dose is not the standard recommendation. 99. Which of the following interventions is most important for a healthcare worker exposed to hepatitis B? A. Immediate administration of HBIg, hepatitis B immunoglobulin, and vaccination. B. Post-exposure prophylaxis with antivirals. C. Monitoring liver enzymes for 6 months. D. Starting antiviral therapy immediately. Answer: A. Immediate administration of HBIg, hepatitis B immunoglobulin, and vaccination. Rationale: after exposure to hepatitis B, healthcare workers should receive both the hepatitis B vaccine and HBIg, hepatitis B immunoglobulin immediately. This combination provides post-exposure prophylaxis to prevent infection. Monitoring liver enzymes or starting antiviral therapy are not immediate post-exposure interventions. 100. A patient with chronic hepatitis B presents with abdominal pain and jaundice. What should the nurse prioritize in their assessment? A. Assessing for signs of liver failure and cirrhosis. B. Assessing for respiratory complications. C. Assessing for kidney function. D. Assessing for signs of anemia. Answer: A. Assessing for signs of liver failure and cirrhosis. Rationale: in a patient with chronic hepatitis B who presents with abdominal pain and jaundice, the priority is to assess for signs of liver failure or cirrhosis, as these are common complications of chronic hepatitis B. Respiratory complications, kidney function, and anemia are not directly related to hepatitis B. 101. Which of the following is an expected finding in a patient with acute hepatitis B infection? A. Elevated serum bilirubin levels. B. Decreased serum albumin levels. C. Increased white blood cell count. D. Decreased liver enzymes. Answer: A. Elevated serum bilirubin levels. Rationale: in acute hepatitis B infection, liver dysfunction can lead to elevated serum bilirubin levels, causing jaundice. Decreased serum albumin levels may occur in severe liver disease, but are not typically seen in acute infection. An increased white blood cell count is not characteristic of hepatitis B, and liver enzymes are usually elevated, not decreased, during acute infection. 102. Which of the following statements about hepatitis B transmission is true? A. Hepatitis B is transmitted through fecal-oral contact. B. Hepatitis B is transmitted via contaminated water. C. Hepatitis B is a bloodborne infection. D. Hepatitis B is transmitted by droplets. Answer: C. Hepatitis B is a bloodborne infection. Rationale: hepatitis B is primarily transmitted through blood and bodily fluids, such as semen and vaginal fluids, and is not transmitted via fecal-oral contact, contaminated water, or droplets. Healthcare workers are at higher risk due to potential exposure to blood. Answer: A. High viral replication. Rationale: a high HBV DNA level indicates active viral replication. This is important in monitoring the severity of the infection and the need for antiviral therapy. It does not indicate normal liver function, nor does it suggest the patient is non-contagious. Chronic hepatitis C co-infection would be tested separately. 103. A patient with hepatitis B has a high HBV DNA level. What does this indicate? A. High viral replication. B. Liver function is normal. C. The patient is no longer contagious. D. The patient has chronic hepatitis C co-infection. 104. What is the primary role of the hepatitis B e antigen, HBAG, test in monitoring a patient's infection? A. To indicate active liver damage. B. To assess the degree of viral replication. C. To determine the effectiveness of antiviral therapy. D. To identify the presence of hepatitis D co-infection. Answer: B. To assess the degree of viral replication. Rationale: HBAG is a marker of active viral replication, and its presence indicates that the virus is actively reproducing in the liver. This helps to assess the level of infectivity and the need for antiviral therapy. It is not used to assess liver damage, monitor antiviral effectiveness, or identify hepatitis D. 105. A patient with chronic hepatitis B is undergoing antiviral therapy. What should be monitored regularly during treatment? A. Serum albumin levels. B. Liver function tests, ALT/AST. C. Electrolyte levels. D. Red blood cell count. Answer: B. Liver function tests, ALT/AST. Rationale: regular monitoring of liver function tests, particularly ALT and AST, is essential during antiviral therapy to assess the effectiveness of treatment and any potential liver damage. Serum albumin, electrolyte levels, and red blood cell count are not primary indicators for monitoring antiviral therapy in hepatitis B. 106. Which of the following is an indication for liver transplantation in a patient with chronic hepatitis B? A. Presence of severe liver cirrhosis. B. Positive HBsAg test. C. Low viral load despite antiviral therapy. D. History of recent hepatitis B vaccination. Answer: A. Presence of severe liver cirrhosis. Rationale: liver transplantation may be considered for patients with chronic hepatitis B who develop severe liver cirrhosis or liver failure. The presence of HBsAg, low viral load, or a history of vaccination are not indications for transplantation. 107. What is the role of the hepatitis B core antibody, anti-HBC, in diagnosing hepatitis B infection? A. It indicates immunity to hepatitis B. It confirms active viral replication. C. It shows past or ongoing infection. D. It indicates the presence of a hepatitis C co-infection. Answer: C. It shows past or ongoing infection. Rationale: anti-HBC is present in both acute and chronic hepatitis B infections, indicating past or ongoing infection. It does not confirm immunity, active replication, or the presence of hepatitis C co-infection. 108. A patient with hepatitis B asks the nurse if they can travel internationally. What is the nurse's best advice? A. You should avoid travel to countries with high rates of hepatitis B. B. You can travel as long as you get vaccinated before you leave. C. You should not travel if your viral load is high. D. Travel is generally safe unless you are symptomatic. Answer: D. Travel is generally safe unless you are symptomatic. Rationale: traveling is generally safe for people with hepatitis B as long as they are not experiencing acute symptoms or complications. Vaccination should be completed, but it is not required for travel. High viral load may affect the patient's health, but it is not a contraindication for travel. 109. Which of the following is a common complication in patients with chronic hepatitis B? A. Peripheral neuropathy. B. Hepatocellular carcinoma, liver cancer. C. Hypothyroidism. D. Rheumatoid arthritis. Answer: B. Hepatocellular carcinoma, liver cancer. Rationale: hepatocellular carcinoma, liver cancer, is a common complication of chronic hepatitis B, particularly in patients with cirrhosis. Peripheral neuropathy, hypothyroidism, and rheumatoid arthritis are not commonly associated with hepatitis B. 110. What is the preferred method of preventing hepatitis B transmission from an infected mother to her newborn? A. Immediate treatment with antiviral medications. B. Hepatitis B vaccination and HBIG at birth. C. Delaying vaccination until 6 months of age. D. Exclusive breastfeeding. Answer: B. Hepatitis B vaccination and HBIG at birth. Rationale: to prevent mother-to-child transmission of hepatitis B, the newborn should receive both the hepatitis B vaccine and hepatitis B immunoglobulin, HBIG, at birth. This combination is highly effective in preventing infection. Exclusive breastfeeding is safe as long as the newborn receives HBIG and the vaccine. 111. Which of the following is the most appropriate first-line treatment for chronic hepatitis B infection? A. Ribavirin. B. Entecavir or tenofovir. C. Interferon injections. D. Lamivudine. Answer: B. Entecavir or tenofovir. Rationale: entecavir and tenofovir are the most commonly used first-line antiviral treatments for chronic hepatitis B. Ribavirin is not typically used for hepatitis B, and interferon is not the first-line treatment for chronic infection due to its side effects. Lamivudine may still be used, but is less effective and has more resistance issues compared to the newer antiviral agents. 112. A nurse is providing education on hepatitis B to a group of high-risk individuals. Which of the following should be emphasized as the most important prevention strategy? A. Avoiding alcohol consumption. B. Using proper hand hygiene. C. Receiving the hepatitis B vaccine. D. Using condoms during sexual activity. Answer: C. Receiving the hepatitis B vaccine. Rationale: the most effective way to prevent hepatitis B is through vaccination. While avoiding alcohol and using condoms can help prevent liver damage and transmission of the virus, the vaccine provides the most robust protection. Hand hygiene is important but not a direct prevention strategy for hepatitis B. 113. Which of the following is a hallmark sign of chronic hepatitis B infection? A. Jaundice with acute onset. B. Chronic fatigue and malaise. C. Severe abdominal pain. D. Sudden loss of appetite. Answer: B. Chronic fatigue and malaise. Rationale: chronic hepatitis B often presents with persistent symptoms like fatigue and malaise. Jaundice typically occurs in acute hepatitis B, while severe abdominal pain and sudden loss of appetite are not hallmark signs of chronic infection. 114. A patient has been diagnosed with chronic hepatitis B and is started on antiviral therapy. Which of the following is the goal of antiviral treatment? A. To completely cure the infection. B. To reduce viral replication and prevent liver damage. C. To eliminate the need for a liver transplant. D. To prevent symptoms of hepatitis B. Answer: B. To reduce viral replication and prevent liver damage. Rationale: the goal of antiviral therapy for chronic hepatitis B is to suppress viral replication and prevent liver damage, including cirrhosis and liver cancer. It does not completely cure the infection, nor does it eliminate the need for liver transplantation in severe cases. 115. Which of the following is an expected laboratory finding in a patient with chronic hepatitis B? A. Low ALT and AST levels. B. Negative HBAG test. C. High serum HBV DNA levels. D. Low serum bilirubin. Answer: C. High serum HBV DNA levels. Rationale: chronic hepatitis B is characterized by high HBV DNA levels due to ongoing viral replication. Elevated ALT and AST levels may also be seen due to liver damage. A negative HbAg test does not indicate active viral replication, and low bilirubin levels are not characteristic of chronic infection. 116. What is the most appropriate nursing intervention for a patient newly diagnosed with hepatitis B? A. Encourage complete bed rest. B. Educate about transmission and prevention strategies. C. Administer antiviral therapy immediately. D. Restrict fluids to prevent liver overload. Answer. B. Educate about transmission and prevention strategies. Rationale. Education about how hepatitis B is transmitted and how to prevent transmission to others is a key nursing intervention. While antiviral therapy may be needed, it is not always started immediately in an asymptomatic patient. Bed rest and fluid restriction are not necessary in all cases. 117. Which of the following would be most concerning for a nurse and a patient with chronic hepatitis B? A. The patient is asymptomatic. B. The patient has mild jaundice. C. The patient has elevated liver function tests. D. The patient has a low viral load. Answer. C. The patient has elevated liver function tests. Rationale. Elevated liver function tests, ALT-AST, in a patient with chronic hepatitis B indicate active liver damage, which is a significant concern. Asymptomatic patients can still have active infection, and mild jaundice or a low viral load are not necessarily as concerning as elevated liver enzymes, which suggest liver injury. 118. What is the role of the hepatitis B surface antigen, HBsAg, test in the diagnosis of hepatitis B? A. It indicates a past infection. B. It shows active viral replication. C. It indicates the presence of immunity. D. It confirms the presence of chronic infection. Answer. D. It confirms the presence of chronic infection. Rationale. The presence of HBsAg indicates that the person is currently infected with the hepatitis B virus, either acutely or chronically. It does not indicate past infection, anti-HBs, active replication, HBAg, or immunity, anti-HBs. 119. A healthcare worker is exposed to a needle stick injury involving a hepatitis B positive patient. What is the first step in managing this exposure? A. Obtain baseline liver function tests. B. Start antiviral therapy immediately. C. Administer hepatitis B immunoglobulin, HBIg, and vaccination. D. Monitor for symptoms of hepatitis B for 6 months. Answer. C. Administer hepatitis B immunoglobulin, HBIg, and vaccination. Rationale. The first step after exposure to hepatitis B is to administer both HBIg, hepatitis B immunoglobulin, and initiate the hepatitis B vaccine series. This provides post-exposure prophylaxis to prevent infection. Liver function tests and monitoring symptoms are not immediate steps. 120. Which of the following best describes the mechanism by which hepatitis B causes liver damage? A. Direct destruction of liver cells by the virus. B. Immune-mediated destruction of infected liver cells. C. Blockage of bile flow in the liver. D. Increased bile production leading to liver inflammation. Answer. B. Immune-mediated destruction of infected liver cells. Rationale. Hepatitis B causes liver damage primarily through the immune system's response to infected liver cells. The virus itself doesn't directly destroy liver cells, but the immune system targets infected cells, leading to inflammation and liver injury. Blocked bile flow or increased bile production is not typically associated with hepatitis B-related liver damage. 121. Which of the following is most important for a nurse to assess when a patient is taking antiviral medication for chronic hepatitis B? A. Kidney function. B. Electrolyte levels. C. Liver function tests, ALT-AST. D. Red blood cell count. Answer. C. Liver function tests, ALT-AST. Rationale. Antiviral therapy for chronic hepatitis B can affect liver function, so monitoring liver function tests, ALT-AST, is crucial. While kidney function is also important in some cases, liver function is the primary focus for patients with hepatitis B undergoing antiviral therapy. Electrolyte levels and red blood cell count are less commonly impacted by antiviral medications. 122. A patient with hepatitis B presents with confusion and jaundice. What is the nurse's priority intervention? A. Administer intravenous fluids. B. Monitor for signs of hepatic encephalopathy. C. Administer an analgesic for pain relief. D. Encourage deep breathing exercises. Answer. B. Monitor for signs of hepatic encephalopathy. Rationale. Confusion and jaundice may indicate liver failure, potentially leading to hepatic encephalopathy. The priority intervention is to monitor for signs of encephalopathy, such as confusion and altered mental status. Intravenous fluids and analgesics are not the immediate priority, and deep breathing exercises are not relevant in this scenario. 123. A 50-year-old male with a history of chronic hepatitis B presents for a routine checkup. What is the nurse most concerned about in this patient? A. The patient may have developed cirrhosis. B. The patient's viral load will be undetectable. C. The patient will have normal liver function. D. The patient is likely to be cured of hepatitis B. Answer. A. The patient may have developed cirrhosis. Rationale. Chronic hepatitis B can lead to liver damage, including cirrhosis, especially if the infection is not well managed. The nurse should be concerned about cirrhosis and monitor liver function. It is unlikely for the viral load to be undetectable or for the patient to be cured. Normal liver function would be unusual without treatment, and cirrhosis is a common complication in long-term hepatitis B. 124. Which of the following is a common risk factor for the development of hepatitis B? A. Oral contraceptive use. B. Unprotected sexual intercourse. C. Excessive alcohol consumption. D. Smoking. Answer. B. Unprotected sexual intercourse. Rationale. Unprotected sexual intercourse is a major risk factor for the transmission of hepatitis B, as the virus is present in sexual fluids. Oral contraceptives, excessive alcohol consumption, and smoking do not directly contribute to the transmission of hepatitis B. 125. A patient is being treated for chronic hepatitis B with antivirals. What is the nurse's priority action regarding medication adherence? A. Ensure the patient understands the importance of regular dosing. B. Instruct the patient to take the medication only when feeling sick. C. Tell the patient to stop medication if symptoms resolve. D. Recommend taking the medication on an empty stomach. Answer. A. Ensure the patient understands the importance of regular dosing. Rationale. Adherence to antiviral therapy is crucial in chronic hepatitis B to prevent viral replication and liver damage. The patient should understand the importance of taking medication as prescribed, even if symptoms resolve. Stopping the medication or taking it irregularly can lead to treatment failure and complications. 126. Which of the following is a potential complication of hepatitis B that should be monitored for in long-term management? A. Kidney failure. B. Chronic respiratory infections. C. Hepatocellular carcinoma, liver cancer. D. Diabetes mellitus. Answer. C. Hepatocellular carcinoma, liver cancer. Rationale. Hepatocellular carcinoma, liver cancer, is a common complication in patients with chronic hepatitis B, particularly those with cirrhosis. Kidney failure, respiratory infections, and diabetes are not typically associated with hepatitis B. 127. Which of the following should be included in the teaching plan for a patient with chronic hepatitis B? A. You can safely drink alcohol in moderation. B. You should avoid sharing personal items like razors or toothbrushes. C. Your condition is completely reversible with antiviral treatment. D. You no longer need to worry about spreading the virus once you start treatment. Answer. B. You should avoid sharing personal items like razors or toothbrushes. Rationale. Hepatitis B can be spread through contact with infected bodily fluids, so the patient should be educated about not sharing personal items such as razors or toothbrushes to prevent transmission. Alcohol should be avoided to prevent further liver damage. Chronic hepatitis B is not fully reversible with antiviral treatment, and the patient should still take precautions to prevent spreading the virus. 128. A nurse is teaching a patient about the hepatitis B vaccine. Which statement made by the patient indicates a need for further teaching? A. I will receive 3 doses of the vaccine. B. The vaccine will help prevent hepatitis B infection. C. I only need 1 dose for full protection. D. The vaccine is safe and recommended for infants. Answer: C. I only need 1 dose for full protection. Rationale: the hepatitis B vaccine requires a series of 3 doses for full protection. 1 dose is not sufficient. The other statements about the vaccine series and its effectiveness are correct. 129. A patient with hepatitis B asks if they can travel internationally. What is the nurse's most appropriate response? A. You should avoid all travel to prevent spreading the virus. B. Travel is not restricted, but ensure you complete the vaccine series. C. You cannot travel internationally with hepatitis B. D. You can travel as long as you're symptom-free and inform health authorities. Answer: B. Travel is not restricted, but ensure you complete the vaccine series. Rationale: people with hepatitis B can travel internationally, but it is crucial that they are fully vaccinated against the virus. The patient should also take precautions to avoid transmission to others. Symptom-free status does not preclude travel, and informing health authorities is not required unless there are specific health concerns. 130. Which of the following laboratory tests is most commonly used to confirm a diagnosis of chronic hepatitis B infection? A. HCV RNA test. B. HBV DNA test. C. HIV test. D. HBsAg test. Answer: B. HBV DNA test. Rationale: the HBV DNA test is used to measure the amount of virus in the bloodstream and is critical in confirming chronic hepatitis B infection. HBsAg may indicate the presence of the virus, but doesn't provide information about replication, and the HCV and HIV tests are not related to hepatitis B. 131. Which of the following is the most common route of hepatitis B transmission? A. Airborne transmission. B. Bloodborne transmission. C. Fecal-oral transmission. D. Vertical transmission. Answer: B. Bloodborne transmission. Rationale: hepatitis B is primarily transmitted through bloodborne routes, such as through sharing needles or exposure to contaminated blood. While vertical transmission from mother to child is a concern, bloodborne transmission is more common. Hepatitis B is not transmitted through the air or via the fecal-oral route. 132. A patient with chronic hepatitis B is scheduled for a liver biopsy. What is the most important pre-procedure instruction? A. You will need to avoid all fluids for 24 hours prior to the biopsy. B. You will need to stop all antiviral medications for a week before the procedure. C. You should avoid eating or drinking for 8 hours prior to the biopsy. D. You should discontinue any blood thinners immediately. Answer: C. You should avoid eating or drinking for 8 hours prior to the biopsy. Rationale: as with most invasive procedures, patients must fast for at least 8 hours before a liver biopsy to reduce the risk of aspiration. Antiviral medications and blood thinners may need to be adjusted, but fasting is the most immediate pre-procedure concern. 133. Which of the following would be a priority nursing assessment in a patient with acute hepatitis B? A. Monitoring for jaundice. B. Monitoring for upper respiratory symptoms. C. Assessing for recent weight loss. D. Monitoring blood glucose levels. Answer: A. Monitoring for jaundice. Rationale: jaundice is a key sign of liver dysfunction, which is a hallmark of acute hepatitis B infection. While weight loss, respiratory symptoms, and blood glucose monitoring are important, jaundice is the most directly related to liver function and hepatitis B. Answer: C. Supportive care and monitoring. Rationale: acute hepatitis B typically resolves on its own with supportive care, including rest, hydration, and monitoring. Antiviral medications are not typically required unless the infection becomes chronic or severe. Interferon therapy and liver transplantation are not indicated for acute infections. 134. What is the first-line treatment for a patient with acute hepatitis B infection who is symptomatic? A. Interferon therapy. B. Antiviral medication. C. Supportive care and monitoring. D. Liver transplantation. 135. A patient with hepatitis B asks about dietary restrictions. Which of the following should the nurse include in the teaching plan? A. You should avoid foods high in vitamin C. B. You should limit your salt intake to reduce liver strain. C. You should eat a high-protein, low-fat diet. D. There are no dietary restrictions for hepatitis B. Answer. B. You should limit your salt intake to reduce liver strain. Rationale. Limiting salt intake is recommended for patients with liver disease, including hepatitis B, to reduce the risk of fluid retention and ascites. High-protein, low-fat diets may be indicated in some cases, but salt restriction is more directly related to liver function. There are no specific restrictions related to vitamin C. 136. A nurse is teaching a patient who has chronic hepatitis B about the importance of follow-up care. Which statement indicates a need for further teaching? A. I will need regular monitoring of liver function tests. B. I should return for regular imaging to check for liver cancer. C. I can stop treatment if I feel better. D. I should get vaccinated against other types of hepatitis. Answer. C. I can stop treatment if I feel better. Rationale. Hepatitis B is a chronic condition that requires ongoing antiviral therapy even if the patient feels better, to prevent complications like cirrhosis and liver cancer. Regular monitoring of liver function and screening for liver cancer are key components of follow-up care. Vaccination against other hepatitis viruses is important, but stopping treatment is not advised. 137. A patient with chronic hepatitis B is being discharged. Which of the following statements indicates that the patient understands how to prevent the spread of the virus? A. I will share my personal items only with family members who have been vaccinated. B. I will avoid sharing razors and toothbrushes with others. C. I can resume sexual activity without using protection. D. I will donate blood to help others. Answer. B. I will avoid sharing razors and toothbrushes with others. Rationale. Hepatitis B can be transmitted through blood, so sharing personal items like razors and toothbrushes is a significant risk. Family members who are vaccinated are not at risk, but the patient should still take precautions. Sexual activity should be done with protection, and blood donation is not safe for those with hepatitis B. 138. What is a potential complication of hepatitis B infection that requires long-term monitoring? A. Pulmonary fibrosis. B. Hepatocellular carcinoma, liver cancer. C. Pancreatitis. D. Gastroesophageal reflux disease, GERD. Answer. B. Hepatocellular carcinoma, liver cancer. Rationale. Hepatocellular carcinoma, liver cancer, is a well-known complication of chronic hepatitis B infection, especially in patients with cirrhosis. Pulmonary fibrosis, pancreatitis, and GERD are not typically associated with hepatitis B infection. 139. A patient with hepatitis B asks if they can breastfeed their newborn. What is the nurse's most appropriate response? A. You should avoid breastfeeding to prevent transmitting the virus. B. Breastfeeding is safe as long as you do not have any active lesions or cracked nipples. C. You should stop breastfeeding as soon as the baby is 1 month old. D. Breastfeeding is not recommended because it will increase your baby's risk of infection. Answer. B. Breastfeeding is safe as long as you do not have any active lesions or cracked nipples. Rationale. Breastfeeding is generally safe for mothers with hepatitis B as long as there are no active lesions or cracked nipples, which could lead to the virus being transmitted through blood. The newborn should receive the hepatitis B vaccine and HBIG to prevent transmission. 140. Which of the following is a primary goal of antiviral therapy in patients with chronic hepatitis B? A. Cure the infection completely. B. Prevent further liver damage. C. Prevent the need for liver transplantation. D. Eradicate the virus from the body. Answer. B. Prevent further liver damage. Rationale. The primary goal of antiviral therapy in chronic hepatitis B is to suppress viral replication and prevent further liver damage. While antiviral therapy can reduce the risk of liver transplantation and improve quality of life, it does not completely cure the infection or eradicate the virus. 141. A patient with hepatitis B is being evaluated for liver transplant eligibility. Which of the following would be a contraindication? A. The patient has cirrhosis due to hepatitis B. B. The patient has good functional status. C. The patient has no other significant comorbidities. D. The patient has active, uncontrolled infection. Answer: D. The patient has active, uncontrolled infection. Rationale: active, uncontrolled infection is a contraindication for liver transplantation because it increases the risk of transplant failure and complications. Cirrhosis due to hepatitis B is a common reason for liver transplant eligibility, and the absence of significant comorbidities and good functional status are positive factors for transplant consideration. 142. Which of the following is the most appropriate nursing action for a patient with hepatitis B who is being discharged on antiviral medication? A. Advise the patient to take the medication with food. B. Instruct the patient to discontinue the medication if side effects occur. C. Reinforce the need for regular blood tests to monitor the medication's effectiveness. D. Encourage the patient to stop the medication once symptoms improve. Answer: C. Reinforce the need for regular blood tests to monitor the medication's effectiveness. Rationale: regular monitoring of blood tests, including liver function tests and viral load, is essential to evaluate the effectiveness of antiviral therapy. Discontinuing the medication due to side effects or improvement in symptoms may result in treatment failure or worsening of the disease. Medication may be taken with or without food depending on the specific drug. 143. A nurse is caring for a patient with chronic hepatitis B who is receiving antiviral therapy. What is the nurse's priority assessment? A. Assess for gastrointestinal bleeding. B. Monitor for signs of liver failure. C. Monitor for hypersensitivity reactions. D. Monitor the patient's mental status. Answer: B. Monitor for signs of liver failure. Rationale: chronic hepatitis B and its treatment can lead to liver damage, and the nurse should prioritize monitoring for signs of liver failure, e.g., jaundice, confusion, ascites. While gastrointestinal bleeding and hypersensitivity reactions are important, liver failure is the most critical concern in this population. 144. Which of the following is the most effective way to prevent hepatitis B transmission in healthcare settings? A. Hand hygiene and wearing gloves. B. Using antiviral medications for all staff. C. Routinely screening patients for hepatitis B. D. Using universal precautions and safe needle practices. Answer: D. Using universal precautions and safe needle practices. Rationale: universal precautions, including safe needle practices, are the most effective method to prevent hepatitis B transmission in healthcare settings. This includes proper disposal of sharps and using personal protective equipment. Hand hygiene and screening are also important, but universal precautions address the primary routes of transmission in healthcare environments. 145. A patient with hepatitis B is found to have a high viral load and positive HbAg. What is the nurse's most appropriate response? A. The patient is at a high risk for liver cancer. B. The patient is highly contagious. C. The patient should receive immediate antiviral therapy. D. The patient no longer needs to be monitored for liver function. Answer: B. The patient is highly contagious. Rationale: a high viral load and positive HbAg indicate active viral replication, making the patient highly contagious. The patient is not necessarily at high risk for liver cancer yet, and antiviral therapy may be considered, but is not always started immediately in the absence of symptoms. Ongoing monitoring of liver function is still required. 146. Which of the following laboratory tests would be most useful in monitoring a patient's response to hepatitis B treatment? A. HBsAg test. B. HBV DNA levels. C. Serum creatinine. D. Complete blood count, CBC. Answer: B. HBV DNA levels. Rationale: HBV DNA levels are the most useful test in monitoring a patient's response to antiviral treatment, as they directly correlate with viral replication. HBsAg is used to diagnose infection, but HBV DNA is more specific to assessing treatment efficacy. Serum creatinine and CBC are not directly useful for monitoring hepatitis B treatment. 147. A patient diagnosed with hepatitis B is concerned about how it will affect their lifestyle. Which of the following should the nurse emphasize in the teaching plan? A. You should avoid alcohol and discuss any medications with your healthcare provider. B. You will need to stay on a low-fat diet for life. C. You will need to limit physical activity for the rest of your life. D. You will need to quit working to prevent strain on your liver. Answer. A. You should avoid alcohol and discuss any medications with your healthcare provider. Rationale. The most important lifestyle change for a patient with hepatitis B is avoiding alcohol, which can exacerbate liver damage. Discussing medications with a healthcare provider is also crucial, as some medications may affect liver function. A low-fat diet and limitations on physical activity are not typically required unless the disease progresses. Most patients with hepatitis B can continue working as long as they are managing the condition properly. 148. A patient with chronic hepatitis B is scheduled for a follow-up appointment. Which of the following should the nurse expect to be monitored? A. Viral load and liver function tests. B. Blood pressure and electrolyte levels. C. White blood cell count and serum glucose. D. Renal function and oxygen saturation. Answer. A. Viral load and liver function tests. Rationale. Monitoring viral load and liver function tests, e.g., ALT/AST, is essential for patients with chronic hepatitis B to assess the effectiveness of antiviral therapy and detect liver damage. Blood pressure and electrolytes are not typically monitored for hepatitis B, and renal function and oxygen saturation are not directly related unless the patient has complications. 149. A nurse is educating a pregnant patient with hepatitis B. Which of the following is most important to include in the teaching plan? A. You should avoid breastfeeding to prevent transmitting the virus. B. Your baby should receive the hepatitis B vaccine and hepatitis B immunoglobulin after birth. C. You can safely deliver vaginally, without any precautions. D. You should have a cesarean section to prevent transmission of hepatitis B. Answer. B. Your baby should receive the hepatitis B vaccine and hepatitis B immunoglobulin after birth. Rationale. Infants born to mothers with hepatitis B should receive the hepatitis B vaccine and hepatitis B immunoglobulin, HBIG, within 12 hours of birth to prevent transmission. Breastfeeding is generally safe with appropriate precautions, and cesarean section is not required solely for hepatitis B. 150. A nurse is teaching a patient with hepatitis B about the potential long-term effects of the infection. Which of the following should be emphasized? A. Hepatitis B will resolve completely in most cases. B. The patient is at risk for liver cirrhosis and liver cancer. C. Hepatitis B does not cause any long-term complications. D. The infection can be completely eradicated with antiviral therapy. Answer. B. The patient is at risk for liver cirrhosis and liver cancer. Rationale. Long-term complications of chronic hepatitis B include liver cirrhosis and hepatocellular carcinoma, liver cancer. While antiviral therapy can help manage the infection, it does not guarantee eradication, and the infection may not resolve completely. It is important to educate patients about these risks so they can undergo regular monitoring and preventive care.